Okay, welcome to the Duke Spine Institute's live stream of our spine surgery. This will be our fourth surgery for today. This patient comes from
Western New York.
Western New York. New York, not New York City. And he has some problems with his neck. He's got herniated discs, degenerated discs, 2 of them, like so many people do. And has he got twitches? We're going to go in and fix these herniations. 2, 3, 4, 5, 6, 7. Perfect. Shot. Shot.
0.
Give me an AP. Quick. Shot. Shot. All right, so we're a little bit to my side. Okay, back to a lateral. Shot. Guys, we need to do something about the shot. Shot. And shot. Luis, you agree at 6-7? 2, 3, 4, 5, 6, 7?
Yes, sir.
Shot. It's really hard to see. Shot. No, I think it's more my hand in the way. Give me an AP. Shot. All right, let's take a look. Yeah, lateral. Well, I mean, we're in the right spot. Let's just take a look. Shot. AP. So we're going to be fixing his 5, 6, 6, 7. You can see at the top 2, 3, 4, 5, 6, 7. Looks good. I mean, we're in the middle. Let's go back to a lateral. Yeah, we're in the middle. I think it looks really good. So he was presented with the idea of doing a fusion. He didn't want it. We didn't offer him a fusion here, but he was offered a fusion elsewhere. And it's very common for spine surgeons to do fusions today because, well, unfortunately, it's one of the higher paying surgeries. It's the highest paying surgery they can do. And all the stakeholders have figured out a way, the hospitals, the implant companies, and the surgeon, that the fusions pay the most money. So they all are promoting them shamelessly. Shot. Now, there was a time when fusion was the best treatment. However, now that we have endoscopic surgery, it's no longer the best treatment. That is dye leaking out the front. And you can see it running up behind the esophagus and around the pharyngeal region. Okay. Let's get an AP. Shot. Oh. You guys see the esophageal temperature probe? Show them the esophageal temperature probe. It's way off to the side. And that's where the esophagus is.
Yes,
so
we can see that.
what was that? The dye is in the retropharyngeal region. All right, we're going to make our incision. The surgery we do is, we call it relatively bloodless because there's only usually a few cc's of blood loss. What is a cc? It's a milliliter. Shot? Milliliter is a small amount. There's about 20 drops. They make up a milliliter. Shot? So if you lose, say, 20 drops of blood during surgery, you've lost 1 milliliter, ml. The other name for a milliliter is a cc, a cubic centimeter. Shot? Shot? All right. So at this point, we are just in front of the spine. Shot? Let's get an AP. So the first goal here is going to be to get into this C6-7 disc and fix it. All right, perfect. We're dead center where we want to be, right between the longest coli muscles. And we need some inline. Now we're going to advance our dilator into the disc space. I'm going to take out my guide wire. A little sticky from the dye, discogram dye. The discogram dye is a little bit sticky. It's actually the contrast media that makes it sticky. Perfect. Yeah, let me get a little bit more. I love it. So count for us, Jordan, which disc we're at. Show us the vertebral bodies. 2, 3, 4, 5, 6, 7. Everyone agree we're doing 6, 7 and 5, 6. We're starting with the higher disc, the lower disc, 6, 7, the harder one to get to, and we're going to move to, you're not pulling, right? We're going to move after that to 5, 6. All right, perfect. Here we go. A little inline, Dr. Berndes. Shot. We're going to advance. Shot. Nice. You keep an eye on that distal tip, Luis, as always. You can see the tube advancing through the disc. Little taps. It's about 1 millimeter at a time. We need just a tiny bit more in line. Give me a second. Let me get all this lined up. Ready? And shot. Just about there. That was good. A little more, and we're there. I think that's pretty damn good right there. Thank you, everyone. Good work. So we've advanced the tube that we're doing the surgery through all the way to the back of the disc, right where the herniation is. And now we're going to bring our scope down the tunnel, so to speak, and we're going to remove the herniations and as much of the herniation and bone spur as we can. We're also going to clean out the tear in the back of the disc so that it can heal. Little inline. Hold on. Let me get this. Go ahead. Really?
There you go.
Actually, I twisted the tube a little and it came out. All right. It's always an adventure with these surgeries. Beautiful. 2, 3, 4, 5, 6, 7. I check about at least 5 times per patient that we're at the proper level for treatment. It would be most unfortunate if we were not. We call that wrong site surgery. We don't want any of that. Here, hold this there. All right, any questions from our audience?
No questions.
Okay, there's the back of the disc along with the herniation. And you can see a little bit of schmutz there kind of blocking the view. There's the back of the disc right there. You guys see the crack between the bones? Pretty
Yes,
cool,
we do.
huh? Well, that's where the herniation has gotten stuck, in that space. So we're going to try to clean it all up. Let's go ahead and show the audience, Sanjay, why do herniated discs cause so much discomfort? All right, welcome back. And now you can see how a herniated disc causes so much discomfort for patients, so much pain. It is really a function of the amount of inflammation that comes from that herniated disc. And not every herniated disc causes inflammation. Only some of them do. But when they do, boy, it can certainly hurt quite a bit. All right, we're going down to the back of this disc at C6-7. You can see a lot of scar tissue here. And the scar tissue comes from inflammation. Years and years of inflammation as the body tries to heal the herniation unsuccessfully. Okay? What you can think about scar tissue is in a war, scar tissue is all the broken buildings, broken walls, destroyed by ammunition, by mortar, by rocket. Okay? So imagine a beautiful city at the beginning, and then an army comes and shows up and tries to take over the city, so it starts to, a fight breaks out between the people living in the city and the invading force. And both sides do damage. They destroy the city over time. And that's what inflammation is. It's that war. It's your body really attacking the herniation. The herniation says, hey, I have a right to be here. And your inflammatory system says, no, you don't. You're an invader. We've never seen you before. Well, the reason why your body's never seen it before is because what's herniated is the nucleus pulposus. And the nucleus pulposus, you see, it normally lives in the middle of the disc, hidden from your inflammatory system. But just like Bigfoot hidden out in the forest. Once you start chopping the forest down, well, Bigfoot doesn't have anywhere else to go, does Bigfoot? So he gets a job with Slim Jim. Is it Slim Jim? Oh my Lord, you guys are asleep. Do people really fall asleep at work like this? Who does Bigfoot work for? Oh my God, shame on you. What, do you guys ever watch commercials on TV? Huh? You know what I'm talking about? Isn't it Slim Jim? What is it? Right? It's another brand. Oh my God. Yeah, it's a beef jerky. See, that's terrible advertising. I remember Bigfoot, but I don't remember the brand of beef jerky. Help us out here, Sanjay or Henry. My point is, as long as Bigfoot stays hidden in the forest, he's not bothering anybody. But the moment you start cutting the forest away and Bigfoot shows up, everyone wants to attack him and kill him because they think he's a monster. Jack Lynx. Oh my Lord, you were kidding me. Do you not watch TV? What do people do when you go home? Nobody watches TV anymore? It's all phones? You read a book? Don't lie to me.
I do.
What? Who says that? Sanjay? You watch TV?
Yes, I do.
So you should know that it's Jack Link.
Yeah, I was about to say that.
But you're vegetarian, so you wouldn't be paying attention, right?
Yeah, that's true.
All right. The point is, the disc herniation is a monster. It lives in the center of your disc, all tucked away inside the annulus fibrosus. And as long as it stays there, no problem. But the moment it comes out, the moment it is exposed to your blood vessels, which are only found in the outer half of the annulus, then at that moment, your vascular system sees it and says, whoa, you're not supposed to be here. What should we do? Let's do what we always do. We don't have a brain. We can't really process any information. So let's just attack it. Like we've attacked anything we didn't know what it was for the last million years while we've been evolving. So your inflammatory system, not very intelligent, just attacks. Just like Russia attacking the Ukraine. Just brazen stupidity. But, of course, if you ask Russia, attacking the Ukraine, isn't that bad? Russia's going to say it's not bad. Not bad. It's good. If you ask the inflammatory system, why are you attacking this herniation? The inflammatory system says, I'm just doing my job. It's all good. And of course, the herniation is not going to go away on its own. So, the inflammatory system keeps attacking it. And over time, you get scar tissue. You get pain. You get more herniations like this. And eventually, you go and see the doctor and try to get it fixed. And then if you let it go for a long, long time, then you need a fusion. But you could also get this done and avoid the fusion. All right, any questions from our aspiring audience?
No questions.
They know everything. I have a question for you, Sanjay.
Yes, please.
Best Indian restaurant in Orlando?
I think it's Ahmed Indian Restaurant.
Which one?
Ahmed,
How you spell it?
Ahmed.
All right. Why do you like them?
Because I love biryani.
You love the doll?
I mean, I love biryani.
Oh, they're biryani?
Yeah,
They make the best biryani?
I think so.
why do you like their biryani? Why do you like the biryani? The rice is good. It's cooked properly. It's not overcooked. It's not too dry. Seasoned well. Nice vegetables. Why do you like the biryani? I'm not hearing you.
It has chicken in it.
Chicken?
Yeah.
Shame on you. Don't tell Dr. Patel.
Of course not.
It's good chicken biryani?
Yes, it is.
All right. All right, we're almost done with this disc. All right, I'm just about done here. There's really not much herniation in this one. It's really more kind of old, crusty stuff. I don't see any more herniation left. Those are fibers. See the white fibers down there? Those are fibers of the PL, posterior longitudinal ligament. Last little bit, and we'll be done. All right, done. Good job. Looking good. Finished one. We're going to go to the next one. Now that disc had some pieces of herniation, but it also was pretty degenerated. Any questions?
No questions.
Let's show the video then on how does the Duke laser disc repair work.
Copy that. Playing educational video in 3, 2, 1.
At this point, we have finished our Duke laser disc repair at number 6-7 disc. We're now moving to the 5-6. I need to get an AP view. So I'm sliding my dilator along the front of the spine, and I'm hovering over the next disc space. I want to check to make sure I'm in the middle. I am. Can you give me a better AP than that? The head is turned to the side. Can we straighten that head, please, Dr. Berndes? Alrighty then. Shot. Jordan. I go back a little bit. Give it to me. That looks good. Let's go back to a lateral view. Shot. All right, we're right above the disc. Shot. We're entering the disc. Hold on. Getting a little excited here. Shot. A little more. Almost there. Shot. We have so much contrast dye in our blue towel that it's quite literally shot, blocking the view of the spine. Shot. All right, that looks better. Shot. There we go. And again. You see the tear, folks, in the back of the disc right there? That is what we're aiming for. Shot. 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 Perfect. We've moved to the C5-6 disc. 2, 3, 4, 5, 6. Any questions from our audience?
Yes. We have a question from
Shot.
John Resco on Facebook.
Hi, John.
Does your process also take care of the degenerative disc?
Does this process take care of the degenerated disc?
Yes.
No. Not in terms of making it undegenerated. This surgery will fix the symptoms from a degenerated disc, which include pain, shot, numbness, tingling, weakness, shot, but it will not undegenerate the disc. It will not make the disc undegenerated. Shot. Once the disc is degenerated, there's no way to undegenerate it, and there's no surgery in the world that will do that. Once a degenerated disc is going to always be a degenerated disc. Our goal is not to make the disc look good. Our goal is to make the disc not hurt. So there's 3 things that the disc can do. 1, cause neck pain and headaches, pain radiating from the neck into the arms. 2, the disc can pinch the nerve going in the arm and cause arm pain, weakness, numbness, tingling. And 3, the disc can pinch the spinal cord and cause spinal cord damage called myelopathy. Dysfunction. So, neck pain, which includes cervical brachial pain, headaches that are cervicogenic. Arm symptoms, including weakness, numbness, tingling, and pain. We have 10 minutes. Dr. Byrne does 10 minutes. And then myelopathy. So radiculopathy, myelopathy, and neck pain with headaches. That's what these herniations do. And that's what we fix with this surgery. We fix the symptoms. We don't make the disc normal. There's no surgery in the world that will ever make the disc normal again. You don't need a normal disc to be normal. Okay?
We have a comment from John Resco on Facebook.
Yes.
He says, removing these symptoms is great. I have the neck pain, headaches, and arm symptoms.
I appreciate that. I didn't really hear the question, though.
It was a comment.
Oh, thank you. Thank you for clarifying that. And if you could repeat the comment. There's a herniation.
He says, removing the symptoms is great. I have neck pain, headaches, and arm symptoms.
I see. Yes. Yes, neck pain, headaches, and arm symptoms. That is your discogenic neck pain, your discogenic headaches, called cervicogenic headaches, and your arm symptoms are radiculopathy, radiculopathy. Either one. If it's pain, it's radiculitis. If it's weakness, numbness, tingling, it's radiculopathy. Now, if your spinal cord is pressed, then and you have numbness, tingling in your fingers, balance problems, then we call that myelopathy. So far, everything's going well for this patient. We're at the back of the disc at 5-6. We've gotten, you saw all those herniations coming out, right?
Yes, we did.
It's quite interesting. I mean, a lot of the surgery is really just about releasing herniation fragments. You know, surprising, a lot of it really is about just putting something back here to create a conduit or path. See these pieces? Now these pieces of herniation are not scarred in. Like they're free. They haven't scarred enough to the back of the discs. Like these right here. You see that, how it just comes out? Those that we call reverse herniations at Duke Spine. We're the first to coin that term. Anyway, now this right here is a scarred herniation. You see the difference? This is not coming out unless you zap it with the laser. The other stuff just comes out as soon as you create the portal, a path like that right there. See that? Notice the edges of that one are fluffy, like kind of spiky. That means it hasn't really scarred in. The really scarred in disc pieces are smooth. I think we're a little bit overexposed. There's another, just so much herniation here, it's incredible. That's good. Oh yeah, that's better. Much better. There's another one right there. Look at that one. Oh, it's a big one. Reverse herniation. So big it won't even come out. I have to go grab it. The tube inside is about 2.8 millimeters. Thanks. We have 5 minutes left. Let's show the herniation. Just turn the light on quickly. Let's show this thing. Let's go. Bring me a tape measure. You guys see this here?
Yes, we do.
All right, that's it. It's not big. You guys see it?
Yes, we do.
5 millimeters by 5 millimeters. It's a little boulder. All right, but that is a herniation. We've been taking like a bunch of those out already. Which side was I? This one? And we'll keep taking them out till there's no more to take out. Anyway, those herniations, they cause so much pain. There's another one. See it right there? Like that one, see how it's smoother? It looks like a little eel's head looking out of the hole. Like, hey, what's going on here? Who are you? What are you doing? It's smoother, right? And notice it didn't come out. That smoothness means inflammation has scarred it up, like a river rock. You know a river rock? You know when you take a rock and throw it in the river? It's all spiky on the surface, and then over time it smooths out, right? Well, those pieces of herniation that are smooth means they've been there a long time and there's been a lot of inflammation. What were you going to say, Dr. B?
I know the restaurant.
Oh yeah, River Rocks. I heard that you are not going tomorrow. Everything okay?
Yeah.
All right. No problem. No problem. All right. I mean, I don't mean to get personal, but I just want you to know it's available for you. Just about done. We have about, maybe a few minutes left here. I've gotten all the herniation out from the center, and Any questions from our audience? Sanjay.
No questions?
Have we played the Duke Laser disc repair video yet?
Yes, we played both.
All right. Very good. There's the little eel. Let's go back the other way. This should be it. Do a quick look over here. And just about done. Let's take a peek. There is a piece of herniation there. So our patient traveled from New York. He did not want the surgeries they offer in New York, like fusions, bit old-fashioned type surgery, very invasive, lots of complications. And like so many people, he's been watching our surgeries for a long time. I got to grab it out. And he decided to come here and get his DLDR done. And we're just about finished. And he's going to do fantastic. If you have questions, type them up. This is your last chance to ask them. Our next case is a lumbar.
Yes, sir.
And he has traveled to us from Illinois. Is that right? The next one? I know he's a retired firefighter.
He's from Annapolis, Maryland.
Ah, Maryland. I apologize. It's hard for me to keep up these days with all the out of states. Yeah.
We have a comment from King's Move on YouTube.
Yeah.
He says, I need surgery. I'm in debilitating pain.
Well, come on over. Let's get you out of pain. That's what we do. This is the last herniation right here, Berndes. I see it. Oh man, spoke too soon. See how smooth that surface is? That piece has been worked on for a long time by the inflammation. The smooth means it's been there a long time. That was a good one. I think that should be about it. Just take one more peek. Ah, there it is, the last one. That's the big mother of all. Let me see if I can grab it out. No. Try one more time. Not, I'll have to cut it. I think I'm gonna have to cut it. That thing don't want to come out. It's digging its heels in. See that? Amazing what the laser can do, huh? People say, oh, laser, laser, who needs laser? You don't need laser. You do, if you want to do it right. If you want to leave herniations in, you don't need a laser. But if you want to get rid of the herniations, you need a laser. We want to get rid of the herniations. Our patients trust us to do the job right. We're going to do the job right. Right, Berndes? All right. So once again, the next patient is lumbar. My God, the thing is massive. Yeah, there's no wonder why we couldn't get it out. It's like at least 10 millimeters, at least a sonometer. Let me grab it. It won't fit out of a 2.8 millimeter tube. There we go. That's should be one more piece and we're done. There she blows. Come on now. Let me grab it. You guys see how it's really not that hard to do these surgeries. You just have to care enough to learn something new that's better for the patient and stop putting metal in people's necks. Unfortunately, most doctors aren't capable of doing that. We're done. Good job, everyone.
Lights on, please. Thank you.
It's kind of fun surgery anyway. Why is the suction not working? No, it's not. Shouldn't be full. We need suction.
There you go. Yes, yeah.
What, did the ghost of the OR come and unconnect it? Here you go. Got it. That makes perfect sense. Luis is too funny. All right. We are done. Any questions?
No questions.
Great. Everything went well. All of this with a 4 millimeter cut, 4 millimeter incision. How big is 4 millimeters? About 1/8 of an inch. Tiny. As a matter of fact, our patients always say no one can find the incision about a month later. All right, if you have questions, feel free to type them up and I'll come and answer them for you. I'll be there in about less than 5 minutes. Take your time, Luis. And good morning, I'm Dr. Ara Dugmajian. It's August 10th, 2022. I'm here with one of my patients who traveled to Duke Spine Institute because she had 3 herniated discs in her neck. They were causing problems for her like neck pain and weakness and numbness in her arm. And she just underwent the Duke laser disc repair yesterday, less than about 24 hours ago. And she's here today for her post-op day 1 check. How do you feel?
I feel amazing.
Good. You want to tell us, did the surgery help you, the Duke laser disc repair, and how did it help you?
Absolutely. I have 0 pain. I am not on any medication, even the ones you gave me. Don't need my muscle relaxer, don't need pain medicine. I immediately had all my strength back. All my fingers feel just like normal. I'm back to normal.
And you're actually wearing an outfit here. What is this outfit?
Yes, this is my work uniform. I came directly from work here. I went to work at 5 a.m. this morning after surgery at 7:30 yesterday. I reported here. So
you're right.
Went right back to work.
Yep, and had you had a fusion done, an ACDF, you would have been out of work for how long?
I don't know, because nobody offered me a fusion. They absolutely refused to fix me.
Well, if she'd had a fusion, she would have a huge scar on her neck, which you don't have. Show them your scar. How big is that?
4 millimeters?
4 millimeters. And you would actually be out of work for about 3 months with a fusion. Yikes. 3 months minimum.
Oh no, can't do
and
that.
Yeah, that's assuming it went well. And you can actually see in this video here the comparison between the Duke laser disc repair and a cervical fusion which is a far more invasive surgery with a metal plate and cages, and you lose movement permanently. Have you noticed how your movement is since you had the Duke laser disc repair? Is your neck movement good?
Yes, I'm able to nod and I have full range of motion again, very carefully. And I'm able to walk normally. Right before surgery, you might have noticed I was waddling around, and I can take my normal steps again in a straight line. There's no dizziness. I don't have to hug the wall. It's great.
Yeah, the reason she had balance problems is because her spinal cord was getting pinched on by the herniation, which we got in there, and when you watch the video, you actually see there's a herniation pushing on your spinal cord, and I use the laser to remove that herniation and get the pressure off your spinal cord and the nerves. So I'm very happy with the results. Your surgery went perfect. We lost just a few drops of blood, and here you are the next day back to work, and that's incredible. This is why the Duke laser disc repair endoscopic surgery is so amazing, is people can have a great result, have low risk of the surgery, and be back to work the next day if they want to. All right, so what kind of symptoms did you have before your surgery? How were they affecting your life besides your balance problems?
Oh, I had severe pain that would make it to where I couldn't do my job. I'd have to have my coworkers repeat things to me often because I was in such pain I couldn't concentrate, couldn't listen to them. I had to be very careful walking around the office. I'd ping pong down the halls. I had trouble typing, lots of typos because I couldn't feel half my hand most times. I wasn't able to drive a bus at all. It's very dangerous when you can't have a grip on your steering wheel, can't reach properly for the controls when you have pain that's preventing you from moving. I have 7 mirrors to check in a bus. I couldn't move my head right. It just was a bad situation.
And so it really affected your quality of life and your ability to do your job. So we're real excited. Now you're doing better and hopefully go back to being normal.
Yeah.
All right, is there anything else you want to tell your fans out there?
I would say that when you watch his videos, it's a little QVC-ish, but he is not lying. It's all the truth, and you better come and see Dr. Duke because it's worth it. It's worth every penny. I'm not afraid that I paid for this, and even if I don't get any of that back, it's totally worth it. And I don't know if anybody's ever called you a tool before, but you were definitely the tool I needed to get my own self fixed when nobody else would.
I am God's tool, so I try to do what God asked me to do and help people.
Right.
So that's okay to be a tool. Well, congratulations.
Take care.
And I'm very happy for you.
It was a good handshake, right?
Yep,
Yes,
very
it
good.
is.
Yeah. All right, take care.
All right.
I'm Dr. Ari Duke-Majan with the Duke Spine Institute. We have a patient who just had surgery yesterday. And if you were tuned in online watching our live surgery broadcast, you saw her get 2 discs fixed in her neck. She's had a prior fusion done with an ACDF and a metal plate, so we fixed the disc above the fusion and below the fusion. She had adjacent segment disease. And how long were you suffering with neck pain and right arm symptoms before you came to Duke Spine to get it fixed yesterday?
Over 20 years.
Over 20 years.
Over 20 years.
And you had the Duke laser disc repair done. You can see we had to make 2 incisions on the front of your neck. How do you feel after the surgery you had yesterday?
Awesome. Never felt like I've not felt like this, and I couldn't tell you how many years. I've not been able to actually have a normal life due to the pain. Hurting so bad, having to lie down during pretty much after lunchtime.
Do you still have that pain right now?
No, sir.
It's gone.
Gone, yes.
Yeah, your neck is still a little stiff, and you
Yes.
got to get used to that. But you did have the fusion, fusions always cause neck stiffness, and we can't fix that. But the pain we can fix. So the pain you had before is gone.
Yes, sir.
You happy?
Very, very happy. That's an understatement.
Now you have a funny accent because you come from Bluff City, Tennessee. Isn't that right?
Yes.
All right. And why did you travel to Florida for your surgery?
Done a lot of research, and then I found you. Thank God. Greatest blessing that I've ever had. Best doctor I've ever been to in my life.
Thank you.
I can't really put into words how I feel. It's beyond It's the greatest blessing ever. It truly is.
Well, I'm glad you're doing well. I know your husband is here. He's been very supportive. He was here throughout the surgery yesterday, and you can actually see in the video footage that we made 2 tiny little 4mm cuts in the front of your neck, went down through the neck, not damaging anything inside, and getting to the herniations where the tears were. And actually, you could see the tears on the discogram that I did, and they were big. And we were able to get in there and clean out all the herniations with the laser, and we didn't have to do fusion anymore. We didn't make your neck any worse than it came here with. And the nice thing about the Duke laser disc repair is it's a stabilizing procedure, getting rid of pain and neurological compromise. I checked you today. You came to us with weak arms, and now you have normal strength in your arms just 12 hours, 24 hours after your surgery.
Yes. Not had that in so many years. So many years.
All right, well, is there anything else you want to say to your fans out there?
Anybody suffering with chronic pain, you have no idea. It is well worth coming to see. Like I said, he's the best doctor I've ever been to in my life. He actually cares. First doctor I've ever had in my life to hug me and ask me how I'm doing.
And compliment you on your nails.
Exactly. He loves my nails.
I
He
do
loves
love
my
your
nails. Highly recommend him, like I said. Very well worth everything. He truly does care. And the team here is awesome. The nursing staff, everybody was tremendously, I can't express enough how everybody was so good to me and just went out of their way to make sure that I had everything I need. I was comfortable. You know, it was just a very wonderful experience. It truly was.
And I appreciate you sharing. You also had the Duke plasma rhizotomy, I just remembered, because she had facet joint pain as well as the disc problem. And she was having pain turning her head to the right, weren't you?
Oh yeah, I was having extreme pain. I was turned into when I couldn't hardly turn to my right. It was going down into my right arm extremely bad.
And that's gone.
Yes.
Amen. And it's gone permanently. So I'm very happy for you. When are you heading back home?
Saturday morning.
All right. Well, enjoy Florida for a few more days. You take care of yourself. You've got my phone number if you need anything.
Yes.
All right.
I thank
take
you
care.
so very much.
You are more than welcome. It's my pleasure to take care of you.
Even with my funny accent.
All right, let's get you out of here, okay? Go enjoy the beach or something. And good morning, I'm Dr. Ara Duke-Majan, CEO and founder at the Duke Spine Institute in Florida. I have one of my patients who just had surgery yesterday, and he traveled from New York with his lovely wife, and they are here for the Duke laser disc repair, which he had done yesterday morning, just 24 hours ago. What kind of problems were you having with your neck before the surgery yesterday?
So about, 20 years ago I had a pool accident, and then in 2009 I had seen a doctor and I had a fusion done. And then after that fusion, which was C5-C6, years went by and I started having problems again with the neck. Severe pain, sharp pain going down into the arm, pains along the back, problems sitting, problems sleeping, constant pain. Went to pain management and tried a list of different type of, chiropractic, physical therapists, and just couldn't get rid of this pain that I had in my neck.
Right.
So I was recommended to see a surgeon in the New York area. I went to him and he recommended a fusion of C5-C7.
Right.
So I researched more and I found you online, and we had a Zoom meeting and you reviewed what my issue was from an MRI, and I was just amazed at what you told me you could do with no long-term effects. I mean, here I am, I had surgery 24 hours ago. You would never know it. Look at me. You're not holding me up, right?
No.
Is that amazing?
This is
Truly had surgery, truly. And I feel so much better.
It looks like
Yeah.
you're turning your neck a lot better.
I am, see that?
No pain.
Without
with that, is it?
hesitation.
Yeah,
So that's
just like
great.
that.
They just took my Band-Aids off. I walked in here, I feel great. I don't have any pain in my shoulder and going down my arm. I can lean back now with no burning sensations in the neck. It's just amazing. And my original fusion, when I heard they wanted to do another one, I was worried because it was so painful. I must have been in bed for a week and a half before I can even move around. And they put like a drainage in your neck It was just very like uncomfortable.
Barbaric.
Yeah, it was like crazy. And then I'm like, you know, why isn't everybody coming down here?
They should, because we have figured out the right way to treat herniated, bulging, degenerated discs in the neck, and it's with a laser and endoscopic surgery. And you found us, you came, you experienced both, because you had the fusion years ago in 2009, now you had the laser. How would you compare the two in your mind?
Night and day.
Yeah.
I mean, I would never get a fusion again. Never.
Well, now that you've had your surgery, I know you were asking if you can go to the beach today and go in the water, and I said yes. What kind of things are you going to do now that your life is going to be without this pain?
My activity is going to be much better, and enjoyment of life, my family. Don't have to go lay down in the middle of the day when people are over. It's just going to be great. It's a new start.
Absolutely.
So I appreciate it. Thank you very much, Doc.
That's why I'm here.
It's perfect. Great job.
Anything else you want to say to your fans out there?
Just listen, it's the good doc here does an MRI review. He doesn't charge you for it. And you'll get to meet him and you'll get to see, you get his opinion on what you need, and you're going to end up being very happy. It's a short ride or flight. I'm coming from New York. It's well worth the flight down here.
Yeah, we couldn't tell you were from New York.
Oh, you couldn't tell by the way I talk?
Yeah, of course I can. Well, congratulations.
Thanks so much.
So happy for you guys.
See, I'm up. I feel good.
Good.
Yeah.
That's why we do it. You're welcome. Dr. R. Duke Machen here with one of my patients who traveled from England through Canada, eventually to get here at Duke Spine Institute yesterday for his surgery. And you had the endoscopic Duke laser disc repair. We can see your incision, 4 millimeters, just tiny. And we fixed your C5-C7 disc, which was herniated. What kind of problems are you having from the herniated disc at C5-C7?
Neck pain, arm pain, numbness, tingling, just, you know, a lot of discomfort from it. Yeah, just pain.
You still have that pain today?
No, I have
Gone.
it's gone. I have no pain today. I have no numbness or tingling in my arm, which was the major thing for me. Was every time I moved my arm or I was leaning for something, it would tingle, or you know, and it's just not a nice feeling. So.
You happy?
Oh yeah, very happy. Yeah.
Good.
Yeah.
And I think when we talked one time, I think you're a Formula One fan. Is that correct?
Big Formula One fan. Yes, I know your son is Formula 3.
F3, but
Yeah.
he's decided to forego racing and go to Princeton instead.
I actually saw that. I was following him, and he ran some races in Formula 3 this year, and then just decided not to. So
Yeah.
that was the reason, was it?
Yeah.
So what's your thoughts on that?
I have mixed feelings.
Yeah, I thought you would.
I think he's the most talented driver to ever come out of the United States,
Yeah.
but his feeling is he's too far behind. If you look at his days in a car, he had 45 days in a car his whole life.
Oh,
And
wow.
he's going up against drivers that are being groomed by the Ferrari Academy. and
That have been
Mercedes.
doing it from a
And
young
they-
age.
They've got 400 days
Yeah.
in the car,
Yeah.
400 plus. So just the gap to catch up, I think
Too
he's right, it's too much. He was about a second off the pace at the FIF3 test in Jerez, Spain. And the team, the British team that wanted him, Carlin, they felt that he could make it up, but he had doubts and he decided that he just wants to go to school and, you know, hopefully become a doctor.
Well, good for him.
Yeah, I agree. I had the same decision to make when I was his age for soccer, and I chose university as well. So
Yeah, good for
it
you.
doesn't surprise me.
And look at you, you're helping people. So.
Yes, I'm very happy with my choice, and hopefully you will be as well.
Yeah.
So what are you going to do now? Yes, this guy is quite a character, isn't he? We did his surgery, and he's very happy. He's a Formula One fan, and but the one we just did, we just finished, it went well. We fixed 2 discs. They were herniated and degenerated. You saw all the herniations coming out from the back of the disc where they were, pushing and irritating the nerves and causing neck pain. Our patient is from New York, and he came down here because he didn't want to go through a fusion. And that's all they could do up in New York. I don't blame him. I used to do fusions all the time, but then I got out of it because they're so invasive and cause so many problems for patients, even if they go well. All right, we have a question.
Yes, one question. This comes from JMC on YouTube.
Hello, JMC. I'm Dr. Duke Machen.
They ask, why is it that a radiology report will normally, or or will normal a MRI of spine, and when the surgeon looks at an MRI, it shows severe spinal stenosis?
Great question. You're asking the age-old question. That is, if you ask two doctors to look at a patient and figure out what's wrong, they're going to come up with different answers. That is the problem. That's why they call it the art of medicine, because each artist sees things differently. In the end, you need the one that sees it the right way, that can fix you. And the problem is all these doctors being artists, they end up not actually helping the patient because they don't see the problem for what it is. Duke Spine Institute is literally the top in the world at making the diagnosis as to what's causing the problem. And we use a combination of physical examination as well as the MRI and other diagnostic tests. But to me, the most important test is the physical exam, and then I look at the MRI to confirm. All I can tell you is I can make excuses for doctors missing the diagnosis, but in the end, they miss the diagnosis. It happens about 95% of the time. So if you want the right diagnosis, come to the Duke Spine and use our free MRI review. It's mri.dukespine.com, mri.dukespine.com. And you can upload your MRI. I will personally look at it, figure out what's wrong, and we will give you a treatment plan that will eliminate the pain. Any other questions?
That is it.
Have a wonderful afternoon. We've got 2 more surgeries still to go. The next patient is a bilateral 4-5 and right or left 3-4. He's got herniated disc in his back. He's got back pain going down both legs. He's had prior surgery at the Bonatti Institute multiple times. They carved up his back. You're going to see it. It looks like a ladder going up his back. Anyway, he's a fireman. He's traveling here from Illinois.
I think so, yeah.
And he wants to get rid of the back pain and the leg symptoms. So he's here with his lovely wife. He'll be next. Our last patient will be a thoracic Duke laser disc repair.
Maryland. Excuse me.
Oh, he's from Maryland. I keep saying Illinois.
All good.
It's Maryland. He's from Annapolis, Maryland. That's right. So he'll be next.